anxiety attacks and panic attacks. So everybody experiences some form of anxiety at some point in their life. It can be helpful. It's a natural response that allows us to avoid dangerous situations, and also to enable us to find solutions to problems. So it's good to have a degree of anxiety, and if we didn't have anxiety, we wouldn't be functioning normally within society. However, this increasing sense of anxiety can vary from a continual sense of unease and being on edge to an overwhelming panic, which can just completely engulf you, think that you're having a heart attack and think that you might be about to die. So anxiety can affect at all different levels, and it can affect things like your heart. It can lead to palpitations, it can lead to chest pain, make you flush, a rapid heartbeat, and all sorts of those sort of feelings which are really tense and really frightening. They can cause you to become breathless and hyperventilate. They can cause dizziness, headache, sweating, tingling, numbness, dry mouth, and a sort of tremor can occur as well. They can affect your gastrointestinal tract and make you feel sick. Vomiting, may give you diarrhea, a sort of choking, gagging type feeling. It's all elements leading on your sort of fight, flight and fright type response that is making that more acute at this time. Various things in your life can predispose you to suddenly being more anxious. Things like the menopause is a real classic, but life events can as well. And some people just have anxiety attacks, and they can get those treated. There are ways to help, which again you can learn from. We've got lots of resources on our sites that can help you. The other thing that this sort of increased anxiety can cause are muscle aches and pains in the neck, the shoulders, the lower back, needing to pee a lot. It can make you worry, unrealistic fears about all aspects of life. It can affect your memory and your concentration, your ability to make decisions. It can make you irritable and confused, and anger out of all proportion from what might be expected. Restless, incredibly tired, but you have disturbed sleep and weird dreams, intrusive thoughts. And sometimes you can start having behavioural effects with sort of compulsive behaviour, where you check whether you've locked the door about 6 times when you're going out, or you have to go to the loo multiple times before you leave the house. You might start to actively avoid social situations and social interaction, and start becoming a little bit more withdrawn. So those are all things to look out for, to recognise somebody might be having issues with anxiety. However, what I want to do now is tell you how to help if somebody is having a panic attack. Now, panic attacks are an extreme feeling of fear and dread. They can be totally overwhelming and lead you to want to escape some sort of uncomfortable situation, but you might not even know what it is. It can just come on in the middle of the night, in the middle of the day, for no apparent reason, and be overwhelming. So panic is a perfectly normal response, and the roller coasters and things are designed to induce a degree of that sort of feeling. However, for some people it causes major problems, and when the panic attacks take over, they cannot function, and very often they end up being admitted to hospital with a possible heart attack, asthma attack, or as a really serious panic attack. So sort of signs and symptoms I explained earlier, so pounding, racing heart, short of breath, sick, dizzy, sweating, thinking that they might die, they might faint, and they might just be unable to cope. One of the things to do is to try and take them away from whatever might be triggering it, if there is an obvious cause. Speak to them sort of in positive, supportive terms, and get them to focus on their breathing. So breathing slowly in and slowly out whilst counting to 5 can actually counter an awful lot of those panicky feelings, because it will bring in your parasympathetic to play, whereas your sympathetic nervous system has gone completely out of all control during this panic attack. Some people find stamping on the spot can help them concentrate on something. And then there's various grounding techniques that can be incredibly helpful as well. So they are particularly useful if you have a feeling of sort of disassociation and not quite being there whilst you're having your panic attack. And they can make you feel safer and more together. They can also help if your panic attack's caused by flashbacks. So concentrating on the sounds that are happening right now. Walking barefoot, wrapping yourself in a blanket and actually concentrating on the feeling of it around you, and touching and sniffing something with a really strong smell. Now, some people that are prone to panic attacks find that carrying something around, something with a really strong smell, maybe something pepperminty or lavender, or something that they associate with something comfortable and safe, can help them to control their panic attacks and stop them getting out of control. If they are becoming overwhelming and regular and disturbing your life, then there are a lot of things that can be done, and the first port of call would always be to talk to your GP.